Fazil Khan was 14 months old when he contracted fever in mid-October. His family initially took him to the local doctor for medicines. The fever didn't go. The rashes on his body were there. And days later, he breathed his last on the morning of 27th October, hours after he had been taken to the PMC-run Rajawadi hospital with complaint of breathlessness. He was diagnosed with measles.
मेरी तबीयत खराब थी, मैं एडमिट थी ना, तो उसके चक्कर में नहीं हुआ था। मेरी बहन मेरे बच्चे को संभालती थी, तो उसको इतनी नॉलेज नहीं थी। मुझे नहीं पता, नहीं आते भी होंगे तो मेरा घर बंद रहता था।
His cousin who lived next door died a day before, and few hours later after Fazil's death, another of his cousin lost his life. In and around Mumbai, as of 25th November, there are 260 cases and 13 deaths. Measles is an airborne infectious disease that normally affects children below 5. One of the main reasons for an outbreak this year is low immunization.
We need to understand what we have faced since last 2 years, the COVID pandemic situation. And during that period, mainly many of the children, they missed their immunization schedule basically. It was not like there were no immunization camps held in the community, but many parents, they thought ki this is not the time for child to get vaccinated, or they were scared of something else, they were scared of COVID, or also there is a hesitancy amongst some of the community in some of the areas in city of Mumbai, and this has added the unimmunized burden into a particular area, and then more number of cases are seen at these places in the form of outbreaks.
At the time of the outbreak in October, only 43% of the targeted children in Mumbai had received the first vaccine dose, while 41% of the targeted kids had been fully vaccinated. In comparison, in 2021-2022, 74% received first dose, while 82% of kids received both doses. In 2020-2021, 87% of the targeted kids were given first dose, while 87% of the targeted kids were given both doses. In 2019-2020, 92% of the targeted kids were administered with first dose, while 90% of the targeted kids received the second dose. As per BMC sources, around 20,000 kids this year were either partially vaccinated or not vaccinated at all. Health officials point to vaccine hesitancy and low awareness amongst people, especially in slum pockets. Dr. Rajesh Prajapati runs a clinic in Govandi area and says that since last week, he is seeing 9 to 10 suspected measles patients every day on an average.
इन्फेक्शन का चैन है जो कि मालनरिश होना, उसके बाद इन्फेक्शन होना, उसके बाद वापस मालनरिश होना, ये चैन चला रहता है। अभी मुझे समझ में आता है कि बच्चे थोड़ा सा ये है कि स्लम एरिया है, तो यहाँ पे बार बार इन्फेक्शन होते रहते हैं, और इन्फेक्शन होने की वजह से भी ये विटामिन ए की डेफिशिएंसी भी मिलती है यहाँ पे, क्योंकि वो प्रॉपर जो पिलाना चाहिए वो टाइम पे मिलता नहीं। अभी आप बच्चों को 9 महीने पे वैक्सीनेशन लगना चाहिए था।
Many parents are either unaware or scared of taking vaccines.
कोवरेज नहीं दिया था, मतलब बच्चे जो हुआ था उसको दिए थे।
तो क्यों नहीं दिया था टीका? जो 9 महीने में देना होता है वो टीका नहीं दिया आपने?
मालूम नहीं था, तब क्या करें। मालूम होता तो दिलवा देते ना, जैसे अभी हम लोग थोड़ा परेशानी में है।
बच्चे लोग को बुखार आ जाता है, उसके लिए मैं उसी टेंशन में लगा कि कोविड लेके चले नहीं। अभी बोल रहे थे कि बुखार आ जाता है, बच्चे लोग सोने नहीं देते हैं। मैं किसी बच्चे को नहीं लगवाऊंगी अपने।
एक क्लासिक पेशंट आहे मेजल्स सस्पेक्टेड पेशंट होतो ना, क्लासिक पेशंट, असं पेशंटला जर उशिरानं आलं तर आपली ट्रीटमेंट काय होते, लेट होतो आपलं, आणि आपला गोल्डन टाइम असतं ज्या टाइमला बाळांना औषध पाहिजे त्या टाइमला भेटत नाही,
वो गोल्डन टाइम निकल जाएगा।
हाँ, गोल्डन टाइम निकल जाएगा, और उसके बाद क्या होगा, ये चीज़ें कॉम्प्लिकेशंस करती हैं।
The BMC has adopted three-pronged strategy: going door-to-door for awareness, finding suspected measles patient and giving them 2 doses of vitamin A within 24 hours, asking them to go to nearby clinics and if need be, referring them to hospitals.
Measles is not normally fatal, but if the treatment is delayed, it can get fatal. The BMC has started its immunization drive, but the question is why so late? And if the parents and certain people are afraid and if there is miscommunication, then why did the BMC not take its awareness drive earlier? Who is at fault in this case? In Mumbai, this is Purva Chitnis for The Print.